It is a battle for every breath. And for the staff caring for these COVID patients, each day the fight is getting harder. At St George's Hospital in South London, they've had to double the number of intensive care beds to 120. Nurses, usually assigned to one patient, are looking after 4, and they're reaching their limits.
You're scared to come into work, you're scared for your colleagues, you're scared for your families. When you go home, you almost don't want to allow yourself that time to crumble, because you think if you start, you won't stop. Because it is that, we're seeing young people, old people, every single person is a member of someone's family.
For staff here, there is a sense of history repeating itself, a feeling reflected in the grim daily figures. The number of people dying from COVID is now close to reaching last April's peak. Today, the UK recorded 1,162 deaths, the second highest number since the pandemic began. The latest number of COVID cases is 52,618, down by almost 10,000 on yesterday, but hospital admissions are rising relentlessly. NHS England today confirmed it has 50% more COVID inpatients in hospital right now than at the peak in April.
That is true in every region in the country now, more COVID inpatients than back in April. And that number is accelerating very, very rapidly. We've seen an increase of 10,000 hospitalised coronavirus patients just since Christmas Day. That's the equivalent of filling 20 acute hospitals with extra coronavirus patients.
And the warnings aren't just coming from the men in suits, but from the families for whom this virus has already struck. Dalvinda wishes she could turn back time and tell her mum not to go to a family wedding she felt pressured to attend. Days later, 67-year-old Jaginda Kaur tested positive for coronavirus.
She spent just over 3 weeks on a ventilator in an induced coma. That's where she slipped away. All I'm saying to people is please don't break the rules. Don't. COVID might not be fatal for you, but it will be fatal for somebody. We can't afford to take any chances with this. This is very serious. I'm just devastated as a family. There's the shock. She only went to a wedding. She's not here now.
It is a warning that those working on these COVID wards desperately hope will be heard as the patients keep on coming. Daniel Hewitt, News at 10.